Alrighty, so this lecture is on the impact on occupational performance for individuals living with ADHD or attention deficit hyperactivity disorder. So, for individuals living with ADHD, symptoms affecting their ability to attend, concentrate, adapt, plan, organize, control emotions, regulate behaviors may impair their performance in any one of their occupational areas. So, common occupational performance deficits for children and adults are in part really dependent upon their age, their occupational roles, and the personal demands of daily life. So it's important to acknowledge that many other conditions that often coexist in persons with ADHD, such as sensory processing and motor disorders, anxiety, mood, and learning disorders, all have their own clinical presentations, and we might see overlapping symptomology that also can impact occupational performance. So we'll go through some areas that might be impacted for our clients. So in terms of ADLs, or activities of daily living, for young school age and preschool children, symptoms of ADHD often hinder their ability to learn and perform basic self-care skills such as dressing, bathing, and grooming. Children and adults with ADHD may exhibit problems initiating and organizing basic self-care tasks, such as completing a morning routine of grooming and dressing promptly and thoroughly. Older children and adults may experience challenges with time management, organization, problem solving, and judgment for maintaining healthy, socially, and contextually appropriate hygiene practices. So that's quite a bit of stuff. So for our IADLs, for individuals living with ADHD, symptoms affecting their ability to attend, concentrate, adapt, plan, and organize often impair their ability to perform the necessary and desired tasks of daily life, such as keeping their house, maintaining a tidy and neat space, getting laundry done, paying bills on time, managing personal finances. Driving a vehicle can also be a barrier for them. And so thinking about adults, and then for children, just initiating and completing their chores might be difficult. And learning basic daily skills such as meal prep and care for pets may also be really challenging for them. So if we think about health management, the occupation of health management, people with ADHD often have the added burden of managing medication regime. So finding additional time for scheduling and attending counseling appointments, and needing to advocate for oneself in the workplace or school, all of these might be barriers for them. Because there are deficits in executive functioning, there may be limited ability to plan, problem solve, and organize their medical care on a consistent basis. So we might see these individuals with poor health literacy. They might have barriers with communication and interventions that the care providers are recommending for them based on their ability to process and organize that information. So it's really key for them to develop healthy routines and habits. And that is a great place for OT right there. You might also see some disturbances in rest and sleep. Many adults and children with ADHD experience problems with sleep and sleep disturbance that often occur as a side effect of many of the medications that are typically prescribed for treating ADHD. And most often the problem is not getting enough sleep or needing to sleep at times that don't really mesh with school or work obligations. Fatigue as a result of lack of sleep can exacerbate the symptoms of ADHD, which can then cause increased inattention, increased irritability, and increased hyperactivity, and this definitely can negatively impact occupational performance at school and at work. So it's really, for this clientele, really important for us to facilitate that development of healthy routines and patterns. So I guess, we can definitely see that education and work are going to be impacted based on the impairments in their executive function, the impairments in their attention. If our clientele is maybe not able to drive and navigating a public transportation system, this could certainly be a challenge for them. If we think about leisure activities, play, leisure, and social participation. Participation in leisure activities and play is often compromised based on their difficulties in social interactions. They might have less interpersonal empathy compared to some of their typical peers. For adults and adolescents with ADHD, social and community participation and sustaining meaningful relationships and finding a balanced lifestyle with quality time to engage in enjoyable leisure activities might be really challenging for them. So big picture, it's important to note that for individuals with ADHD, occupational performance in the area of social participation, play, and leisure may also be influenced by conditions that commonly coexist with ADHD, as we discussed earlier, such as learning, sensory motor, and anxiety disorders. So daily habits and routines that supports one's engagement in required and desired occupations should really be addressed. Interventions targeting habits and routines may really help clients with ADHD overcome dysfunctional patterns such as procrastination by building in scheduled free time and play. Play and social settings that are calming or less demanding, such as quiet versus noisy environments, smaller crowds, might really facilitate improved functioning for these clients and improved engagement with social and leisure activities. So in summary, there are many ways that ADHD symptoms commonly impact one's occupational performance or in the ability to successfully participate in one's daily life. And there are many methods of evaluation and treatment for both children and adults. ADHD is a complex condition, and every client with the disorder is unique. The best practice for managing ADHD is implementing a multimodal intervention approach that is individually tailored to meet the unique presentation of each client with consideration of the client. So really, in conclusion, it depends, and you can really see how there is an overlay and overlapping of potential other diagnoses that could, or other conditions, I should say, that really can impact the client with ADHD. And then you think, well, now that you've overlaid ADHD with a stroke, where there's maybe potential for attention disorders, or you overlay that with new learning because of a new condition. So we really have to support these clients. So with all that to say, if you have any questions, don't hesitate to reach out.